Hello, welcome to yet another video of Acharya NIdana Academy. In this video, we are going to discuss the concept of swastha and atura, that is, healthy person and ill healthy person, or health or ill health in a different way. Before going into this particular concepts, this particular concept of swastha and atura, let us learn something related to the concepts of the as we are discussing earlier. First concept, if the physics, chemistry and biology and fundamentals of Ayurveda we are knowing, then any of the concept of Ayurvedic can be learned with the deepest understanding. Second, whenever we are taking the one particular concept, we have to practice the concept of minimalism. The term minimalism, that means we have to take one particular concept and we have to look from the multiple angles. So, or otherwise we have to do the brainstorming session of that particular topic. Then we can have the deepest understanding. Third, so if we want to know about the concepts of Roga Nidana, then we have to know about each and every concepts of Kriya Sharira or Ayurveda physiology. If you are knowing the concepts of the Roga Nidana from each and every corner, then learning the Kaya Chikitsa will be very easy, or otherwise the treatment principles can be learned very easy. Fourth, whenever we are going into learn any particular concept, first of all we have to identify the pattern identification. Then that will be helpful in making the modification of that particular pattern. And later we can able to create one particular pattern so that the optimum health can be maintained. Pattern identification, let me give you an example for pattern identification, etc. If a person is consuming sour buttermilk for a period of 7 days or so, that will be responsible for the increase of pitta dosha in the body. So that means he will be having burning sensation, etc. in the retrosternal region. So that means we have to modify that particular pattern in the sense we want to reduce the pitta dosha. First of all, we have to stop that particular sour buttermilk consumption. In turn, we have to start the either consumption of milk, etc., which will be reducing the pitta. Pattern identification to make the diagnosis, pattern modification to plan the line of treatment or plan the proper diet and regimen, do's and don'ts for that particular disease, and pattern creation, that is restoring the health of the person. These are considered to be the mottos of this particular academy. And there is no compromise in either the fundamentals will be entertained in this particular academy. So first, in the concept of the swasthya and atura, so we have to first of all know about the health as such. When you look into the Western physiology, human body is composed of approximately 11 systems, each of which will function coherently to maintain the optimum health. So that means whenever if you take the food, that will be immediately going into the alimentary canal, that particular alimentary canal, so that will be transformed into the way that can be absorbed from the alimentary canal into the circulatory system. From there it will be moving into the different cells, each and every cells of the body through the cardiovascular system. When you look into the oxygen, which is very prime gas, which is essential for the human body, so that will be taken up by the nose, that will be entering into the respiratory system. From there it will be entering into the alveoli, from there it will be entering into the pulmonary capillaries, then into the heart, then it will be moving into the different parts of the body with the help of cardiovascular system. So likewise, each system functions coherently so that maintenance of the health can be attained. So that means each and every system is having its own part in maintaining the health of the person. So that means if any of the ill health is possible, if there is any etiological factor is or pathogen is really entering into one particular system, so here that is the cardiovascular system. Let's consider. When cardiovascular system is having a pathogen, what will happen? That will be related to the cardiovascular system. Symptoms may be manifested: breathlessness on exertion, or the cough with pink sputum, or otherwise the person may have the bilateral pedal edema, etc., etc., or the pain in the right upper quadrant. So these are the different symptoms that may be pertaining to cardiovascular system. So in turn, that may be having an impact on other systems also in due course of time. Sooner or later, the person may have an impact on the respiratory system, may be presented with cough with pink sputum. Digestive system may be pain in the right upper quadrant, wherein hepatobiliary system may be afflicted, loss of appetite, or the fullness of the intestines, etc., or the heaviness of the abdomen may be related to the backflow happening in the alimentary canal. So like that, so that is what is considered to be the impact on the different systems may be possible. Here only the two examples that is being given, respiratory system and digestive system, may be afflicted in due course of time if the pathogen is being present in the cardiovascular system. So then, here the respiratory system and its impact. When you think of respiratory system, so how that is responsible for the cardiovascular system affliction? Cardiovascular system affliction, so whenever if a person is suffering from any kind of the respiratory diseases, adequate amount of oxygen supply may not be possible into the pulmonary capillaries, that is resulting in the slower movement of the blood. So how this is slower movement of the blood may happen? That is increased, what do you say, that the RBC production may be the outcome because of this. That means because of this increased RBCs are being produced, that is entering into pulmonary capillaries, and that is responsible for the slower movement of the blood along the capillaries. How that is responsible for the skin manifestation? Skin manifestation, that is the person who is suffering from the respiratory disease, he may have the immunoglobulins secretion. This is what is considered to be allergic, responsible for allergic skin manifestation. Like this, these are the only two examples. Of course, in sooner or later, this may be having an impact on the other systemic functions also. Likewise, the concept of swasthya in Ayurveda. Ayurveda says nearly around 13 Srotas. Here only for the namesake, few Srotas are being explained. So, Pranavaha Srotas, Rasavaha Srotas, Medovaha Srotas, Vajjavaha, Shukravaha, Swedavaha. All these Srotas, that is 13 varieties of Srotas, they are functioning independently to maintain the health. They are functioning coherently together to maintain the health of the individual. Suppose, if the person is having the pathogen in the Rasavaha Srotas, so that means that is actually responsible for the affliction of the Srotomula. Wherein the Srotomula, as per Ayurveda, the Srotomula for Rasavaha Srotas is, that is what is considered to be Hridaya and Dashacha Dhamani. Hridaya, so that is as the Hridaya is Srotomula of for Pranava Srotas also, there may be a possibility of affliction of Pranava Srotas in due course of time when the person is suffering from Rasavaha Srotas affliction. And Dashacha Dhamani in the sense, all the other parts of the body that may have an impact because of the affliction is present in the Rasavaha Srotas. And you think of Pranavaha Srotas, so it is a part of Mahasrotas. And Mahasrotas is containing 3 Srotas: Pranavaha, Annavaha and Purishavaha Srotas. In that particular situation, see the impact, that is Rasavaha Srotas affliction, but the impact may be present in the Pranavaha Srotas, impact may be possible in Annavaha Srotas, impact may be possible in Purishavaha Srotas. And in the other end, as that is moving in the different parts of the body, any cell can be having an affliction because of the pathogen is present in the Rasabhaha Srotas. So, further continuing with the aswasthya or the ill health, the person can have an exposure to millions of etiological factors at a particular time. So, millions of etiological factors, that means that may be exposed to, some of them may be exposed to the mouth, some of them may be exposed to the nose, some of them may be exposed to the eyes, some of them may be exposed to the ears, some of them may be exposed to the urethra, some of them may be exposed to the anus, some of them may be exposed to the vagina, some of them may be exposed to the breast. Depending upon the virulence of the etiological factor, any of the Srotas can be afflicted. So that means if a person is present having the exposure of this etiological factor to the mouth, the person may have an impact on the Pranavaha Srotas, the person may have an impact on the Annavaha Srotas, the person may have an impact on the surrounding Srotas or Bahya Srotas, that is mouth itself. So likewise, if a person is having the affliction related to the nose, the person may have an impact on the Pranavaha Srotas, sometimes the person may have an impact on the Annavaha Srotas also. So for this, refer the previous video, that is the Shita quality and its affliction to the Pranava, Annava, Purishavaha, Srotas, etc., that was been discussed in the previous video. Go through that particular video. So, and when you think of the affliction of the Srotas or the disease affliction of this particular Srotas, so there may be a possibility of affliction of either one or the two Srotomula. One Srotas, usually you have the two Srotomulas, that is two ends for a particular Srotas. Depending upon the entry of this, the etiological factor, the person may have an affliction of that particular Srotas of that particular end. Depending upon the movement of this particular etiological factor, the other end of the Srotas may be afflicted in due course of time. So that means, let us take the example of Pranavaha Srotas. There may be a possibility of affliction of two ends. When the person is having the exposure through the mouth or nose, the initial affliction will be present in this particular occasion will be Mahasrotas. So that means the person may have an impact on Pranavaha Srotas, Annavaha Srotas and Purishavaha Srotas. Whereas the other end of the Srotas, of Pranavaha Srotas is, that is Hridaya. That may be afflicted in due course of time. So the take-home message of today's discussion, that is, human body is composed of 11 or more systems which will be functioning individually and which will be functioning coherently to maintain the optimum health. Each system or any system, if deranged, may have an impact initially towards that particular system, followed by the affliction of the nearby systems, and if still the etiological factor is further continuing, the exposure to the etiological factor is continuing, then all Srotasas may be afflicted sooner or later. As per the Ayurveda aspect, human body is made up of 13 Abhyantara Srotas and 9 Bahya Srotas. Whereas 12 Srotas, Bahya Srotas are observed in the females. Depending upon the nature of exposure, depending upon the area of the exposure, depending upon the orifice of the exposure of Nidana, initially the nearby Srotas that will be afflicted, that will be resulting in the affliction of Srotomula, and thereby nearby Srotas that may be afflicted. So here ends this particular video. What are the major key takeaways from your side? So mention below in this particular video. And what would you like to learn? So comment on that below. And if you are really liking the video, put a thumbs up and spread to this particular video to the maximum number of the true Ayurveda learners, so that we can make a mess, we can make a movement out of this particular small message, so that the each and every true Ayurveda learner so can learn the informations mentioned in Ayurveda in a deeper way. Thank you.